Hello everyone, welcome and thank you for joining us for today's webinar on workforce responsibilities, the key to delivering a great aged care experience. My name is Janet Anderson and I am the Aged Care Quality and Safety Commissioner. It's great to have you today for our webinar. I'd like to start by acknowledging the traditional owners of the lands on which we're meeting, wherever you are in Australia, and paying my respects to elders past and present. I extend that acknowledgement and respect to any Aboriginal and Torres Strait Islander people who are joining us for today's webinar. I'm very pleased to welcome to the panel for today's webinar two colleagues, Mark Richardson, who's the Assistant Secretary, Residential Care Funding Reform Branch in the Department of Health and Aged Care, and Peter Edwards, who works in the Commission as the Executive Director of our Compliance Management Group. I have a few housekeeping messages before we get fully underway. Before we hear from Mark and Peter, well, after we hear from them, actually, we will be moving to a Q&A session, and you can put your questions into us at any time. Just use the question box via the live Q&A tab, which should be visible on your screen. We also have a short survey for you to complete at the end of today's event. Please just stay online and it should pop up. We do value the feedback you give us. You tell us what you find useful about what we've done, tips and tricks, but also areas where you would be appreciative of more information. Please make full use of that opportunity to give us some comments. And finally, or second last, in the handouts tab, you will find links to our recently published regulatory bulletin on workforce-related responsibilities, and also a link to Peter Edwards' compliance blog, where you will find more information on this particular topic. Now, finally, the webinar is being recorded and it will be published on our website in the next couple of days. Every one of you who registered for today's webinar will receive a link to the recording as soon as it's available. Now, on to the actual topic. As I said, we're going to talk today about workforce responsibilities of providers and how it is the avenue, the key to a great aged care experience. Of course, having the right number and mix of staff with the right capabilities is fundamental to every provider's ability to deliver consistently safe, quality care. And that, of course, is what every single aged care recipient needs and deserves. Now, as most of you would know, we have an entire quality standard dedicated to staffing. It's called Human Resources. It's Standard 7. And if you haven't looked at the standards in a while, I recommend that you refresh your memory because it is a really important standard, as they all are. Now, the Standard 7 applies to all providers, no matter what services you're delivering. You might be a residential care provider, you might be delivering home care, flexible care, transitional care, or CHSP services. Whatever you do, this is an important topic for every single provider. Having said that, though, today's webinar will be focusing more on the workforce-related responsibilities of residential providers. And in particular, we're going to be drilling down into the requirement to deliver mandatory care minutes. So throughout today's discussion, we're going to be offering guidance to providers and governing bodies and also explaining our regulatory approach. More than anything, we want your organisation, if you're a provider, to have an effective workforce planning and management strategy in place. And we want to ensure that that strategy is overseen by your governing body, because that's your accountability mechanism. And I'm quite sure there are some CEOs and board members watching today. Please feel free to put your questions through the live Q&A tab, and we'll deal with as many of them as we can when we get to the QA section. Now, today our panel is going to cover the other workforce-related responsibility applying to residential care providers that we've talked about before, which is the requirement for 24/7 RN cover. We're also going to talk about the Commission's regulatory response to these workforce-related responsibilities, the benefits and positive impacts for workers and older people for whom you care, and the support and resources that are available to improve sector knowledge and performance in this area. So let's get underway. I'm going to invite Mark Richardson from the department to kick off our session. Mark, I understand the department has been analysing the care minutes data. You've been collecting it through the quarterly financial report. And I wonder whether you could please tell us what you've found and share your insights. And I see that your slides are already loaded, so away you go. Thank you.
Thanks, Janet. Yes, look, I'll most definitely do that. Thank you very much. Look, as you all know, the government has been funding aged care providers to deliver care minutes since the 1st of October 2022, with a number of funding increases along the way. This includes funding boosts when care minutes became mandatory, the recent increase to 215 care minutes, and a record investment of over $15.1 billion to lift wages in aged care in line with the Fair Work Commission work value case. This has led to substantial funding increases each year, with care funding now around 58% higher than it was in September of 2022, before AN-ACC was introduced. With most of this extra funding intended to fund the additional staffing required by providers to meet their care minutes and to also make sure they can meet the wage increases. To put this in perspective, the average care funding per resident per day has gone from $193 under ACFI to an estimated $305 in 2024-25 under AN-ACC. This represents an increase of $119 in 3 years, or the 58% I just mentioned. I should point out that the analysis of the average funding under ACFI includes care funding only. That is, the ACFI basic subsidy and the form of viability and homeless supplements that were rolled into AN-ACC to ensure that we are comparing apples with apples. It does not include the form of basic daily fees supplement in place in 2021-22 or the hotelling supplement currently in place. This brings me to the care minutes data and what we have been seeing. At the sector average level, total and RN care minutes have increased considerably, hitting 207.71 total minutes and 40.51 RN minutes in the latest reporting period. That is Q4 of 2023-24. This is a significant increase of just over 11% in total care minutes and just over 23% in RN minutes per resident per day since Q1 of 2022-23, which was the first quarter providers were required to report non-mandatory care minutes data in the quarterly financial report, and the quarter before government started funding providers to deliver care minutes from 1 October 2022. Having said that, the reporting also shows a significant proportion of aged care homes are not yet meeting their individual targets. As you can see on this chart, there has been very slow growth in care minutes compliance rates over the last 2 years since government started funding the delivery of care minutes, with less than 41% of aged care homes meeting both targets in Q4 of 2023-24. In other words, around 59% of aged care homes are still not meeting both targets during that quarter, despite the record funding the sector has been receiving. A significant number of homes are actually quite a long way off meeting their targets. For example, over 23% of all aged care homes, or about 600 homes, were more than 10 minutes per resident per day away from their total care minutes targets. And over 15% of homes were more than 5 minutes per resident per day away from their RN targets. This indicates that many aged care residents are not receiving the full quality of care benefits of increased staffing envisaged by the Royal Commission and funded by government. There are also unexpected findings from the data. We are seeing that compliance rates are higher in small rural towns and remote and very remote locations, that's Triple M's 5 to 7, than in Triple M 1 to 4 areas. M3 had the lowest overall compliance rates, with only 30% of homes meeting both targets, followed by M1 homes where only 38% met both targets. The very low compliance rate in M1, which makes up 64% of aged care homes across the sector, was most surprising. It is concerning given the consistent feedback that workforce shortages are most acute in rural and remote areas. When we looked more closely at the data, we identified that provider ownership type is a bigger driver of compliance than location. Overall, for-profit providers have far lower rates of compliance than not-for-profits. For example, just 24% of homes run by for-profit providers in M1 are meeting both targets, compared with 49% of homes run by not-for-profits. Our concern is that this large discrepancy indicates other drivers for low levels of compliance rather than genuine workforce shortages. In order to provide transparency on these results, a new Care Minutes quarterly dashboard has now been published that will be provided on an ongoing basis as a comparison between provider types. In addition, provider-level information regarding Care Minutes has also been published on the department's website. This allows residents and their families to compare performance across providers, not just between services. You can find links to these on our Care Minutes webpage, or simply scan the QR codes or type in the URLs seen on this slide to access them. I want to spend the last couple of minutes to cover off what we have been doing with our Care Time Reporting Assessments program. As most of you know by now, reporting assessments check the accuracy of information reported by providers in their quarterly financial reports and 24/7 RN reports. So far, we've contacted 288 of the total 745 approved providers. These 288 providers own 2,067 services, and we're expecting that providers will address any findings from one service across all of their services. To date, we've identified 120 findings across 78 services, highlighting issues such as poor record keeping that does not substantiate Care Minutes reported, as well as inaccurate information and misreporting. Examples include reporting PCW time spent on activities like cleaning and serving food, incorrectly categorising staff, or not reporting staff absences. While we aim to work with providers to address inaccurate information and misreporting, consequences may include referrals to the Commission and adjustments to a service's star ratings. I'll stop here and hand back over to you, Janet. Hopefully what I went through gives everyone an idea of what the department has been doing and our insights into the data, particularly the story it is telling us about how different segments of the sector are performing on their Care Minutes targets.
Right. Many thanks for that, Mark. That is really useful, and clearly there's a lot of analysis which has been undertaken which has been able to deliver those insights, which I'm sure will develop further over time. I'm getting some questions on the line which go to some of the technical details of the calculations, which we probably won't cover today, but there is information available on the department website, Mark, is there not, that can assist people in understanding the way in which Care Minutes are calculated and the sort of analysis that you might then undertake?
Most definitely. So we have online a range of different guides. We have a 24/7 RN guide, a Care Minutes guide, which details everything that contributes to targets. There's also the new dashboard that I outlined, and that goes into quite some detail in terms of the slides that I've provided today, Janet.
Right.
So people can have a look at that too.
Brilliant. Many thanks, Mark. I really appreciate it. All right. You talked about the potential for referral of particular providers to the Commission. And indeed, that is one of the ways that we take on potential cases, and we obviously look at them from a risk perspective and then make decisions about the way in which the Commission would seek to become involved. That is the cue for me to invite Peter Edwards up to the rostrum. Peter is the Executive Director, Compliance Management. Peter, up to this point, we've been focusing largely on care minutes, but there are other workforce-related responsibilities that providers also have. And I wonder whether you could talk briefly about the requirement for every residential service to have a registered nurse on site 24 hours a day, 7 days a week, and what we're seeing in relation to provider performance against that obligation.
Yeah, look, thanks, Janet, and really great to be with you all. This is a big, complex topic, so and so it's really good to see so many people turn out to listen in on this. So going to your question, Janet, there's obviously for the past 18 months 24/7 RN responsibility took effect, and it's just over a year since mandatory care minutes kicked in. In that time, we have seen the vast majority of residential aged care providers either achieving or making significant progress towards delivering 24/7 RN care, with around 93% of residential services now meeting that particular requirement. While we want to see this percentage obviously climb further, this is really positive to date, because we know that timely clinical oversight, assessment and intervention will always result in better outcomes and quality of life for older people. I also want to commend the successful efforts by providers operating in services in rural and remote areas to recruit more RNs. They are providers that my group and I talk to regularly. Our monitoring activities have confirmed that where 24/7 RN cover is not immediately achievable, there are alternative clinical care arrangements that have, to a great extent, been put in place. And we're seeing these are effective in managing the risk to people receiving care while those services and providers move towards their getting 24/7 RN coverage. So I think this is a good news story and worthy of acknowledgement. It's also tangible evidence of what the sector can do when it commits to working to achieve targets like this.
Thanks, Peter. Yes, there's quite a contrast then between compliance on the 24/7 RN cover and compliance on care minutes, and that's probably worth a longer conversation too. It is clear, and some of the questions go to this very fact, that we are all operating in a sector undergoing very significant change, characterised indeed by strong headwinds and very high expectations from government, from those who need aged care, about the quality and safety of that care. Of course, spurred on by the Royal Commission into Aged Care Quality and Safety, which delivered its report in March 2021, some time back now. Now, the next key milestone is the government's delivery and Parliament's passage of the new Aged Care Act. And of course, that will bring in a new regulatory model and the strengthened quality standards. And that's kind of an ad for coming attractions in some ways. And workforce-related responsibilities will continue to feature prominently in the new Act, in the new strengthened standards, which just underscores the importance of doing more to get it right now. So let's go back to workforce-related responsibilities. Peter, staying with you, we heard from Mark earlier that the care minutes targets are not achieving the same levels of compliance as for residential providers as 24/7 RN, and that in fact different parts of the market may be facing different challenges. And some of the questions go to this point as well. Can you please outline the approach we're taking to regulating compliance with care minutes? Because I know that we have a lot of people online who are very keen to understand this better.
Yeah. Look, thanks, Janet. And as I said at the outset, this is a complex topic, but I'll start with the headline message. and that is that the Commission expects all providers to meet their workforce-related responsibilities and manage risks to people receiving care. So that's absolutely, just want to make that absolutely crystal clear. The Care Minute target isn't a surprise. We in the department communicated to providers well in advance, and as Mark mentioned earlier, extra funding has been provided to support providers to reach targets well before Care Minutes became mandatory in October 2023. We expect providers to spend the care funding they receive from the Australian Government on meeting their workforce-related targets. That's essential to ensure that people receiving care have enough suitably qualified staff to deliver that care to them in the aged care home that they live in. It also reduces the risk of harm occurring to people living in those aged care homes. Our focus is on making sure that the needs of people receiving care, aged care services are met, and we do that through monitoring compliance against workforce responsibilities, amongst other things. I think it's worth taking a moment here to talk about how we do that through what we call the provider supervision model. As part of the Commission's updated regulatory strategy that we released in August, we introduced a new provider supervision model. We are managing any non-compliance or risk with workforce-related responsibilities and other obligations through provider supervision, using the Commission's monitoring and compliance powers to require and compel providers where that's needed to take action. So it's through that lens of our supervision model that I will be talking to you about how we are regulating compliance with Care Minute responsibilities. This is how we go about making sure that residential aged care providers are meeting or are on a sustained pathway towards complying with their obligation to deliver mandatory Care Minute targets. Just to reiterate, each service that is operated by a residential aged care provider will have its own Care Minute target, which is the minimum amount of care each resident should receive each day. I want to stress here that it's important that we don't just think of these targets as something to be met, but as an amount of dedicated care time that each person in care needs and indeed deserves to receive. Having enough aged care workers with the required knowledge and skills to deliver good quality care was a key finding of the Royal Commission, which helps explain why we take non-compliance with Care Minutes so seriously.
Thanks. You mentioned the regulatory strategy. I mentioned it slightly earlier in July this year on our regulatory strategy on our website. Peter, are there any other communication documents that those watching today can access which would help them understand a bit more about our regulatory disposition?
Yeah, look, we've done quite a bit of communication, so I'll just Commissioner, I'll just take the group through this. So a part of regulating well is to ensure that those who are regulated, in this case providers, understand the nature of the responsibility and why it's important. So, but also that we communicate that in a way that helps the sector know how to best reach compliance. So we've spent a lot of time talking to people in the sector to make sure that our communication around this particular obligation is fit for purpose. From April 2023, we've undertaken a sustained communications campaign. One of the things we've done to make it as straightforward as possible for providers to find relevant information is to create a dedicated page on our website for workforce responsibilities. And there is a link to that page, and we'll put the link to that page as part of the webinar. Earlier this year, we also wrote to all providers that reported a shortfall against their service care minute targets. We also met with each of the chief executives of providers that had significantly underperformed against their targets, and I personally participated in some of those meetings. In those activities, we outlined our expectation of compliance and signalled the possibility of future regulatory action, especially if there was persistent and unexplained non-compliance. Last Wednesday, we also published the latest compliance insights post, which discussed our regulatory approach to care minutes. And if you haven't seen this, we also have included that link in today's webinar. And importantly, yesterday, we published our updated regulatory bulletin on provider workforce-related responsibilities, and you can find that document on our webpage, and a link is also included. I really do encourage you to read those documents. We have really worked hard to make them as accessible as possible in the language we use, and we've, as I mentioned, worked with the sector to make sure they are fit for purpose. So I please encourage you to look at those documents. In saying that, I certainly recognise there's a lot of information in the sector right now, but I think this is important, and the Commission has a very clear focus on it, as does the department. We want the sector to understand our expectations, but also our approach to regulation.
All right. Thank you, Peter. Peter, I want to take you back to a phrase you used, persistent and unexplained non-compliance. But before I do that, I just want to insert a question from Margaret, who says the following. Given the choice of meeting care minutes targets or going broke, because we have to increasingly use agency staff, which of the two choices somebody has just deleted the question. Which of the two choices would the Commission prefer?
Look, and that's a really, really good question, and one that we, regularly deal with. And this is why, and when I talk about how we are targeting particular providers for extra attention in relation to this obligation, we do take into account the rate of spend against ANAC funding. Because we recognise that in some parts of Australia, the cost of delivering services might be slightly higher than others. So we do not just look at a single obligation, we look at all the obligations, and we look to understand what a provider's financial position is, because we recognise that sometimes it's the cause of non-compliance is their financial position. So I have a group of staff that actually work with providers around the country where they are experiencing financial viability issues. And if financial viability is an issue that is acting as a barrier to compliance, then what we want both things to happen. We want to support that provider to address their financial viability issues so they can get the right number of staff to deliver care. So we work with the provider, and that, I think that's just an example that of the complexity of the issue, because there are many causes of non-compliance, and we work on the cause. And so I just want to reassure a provider in that situation that we are here to work with the provider, with them, to make sure that we can support them to reach compliance and remain viable.
And if I could just add, though, as a coda to that, of course, yes, we're not doing the work, we're expecting the provider to do the work. Yes. We do not step in and take the provider's part. We stand clear and watch them address the non-compliance. Yes. But we are keen to understand the causes in order to provide guidance where that's useful. Yes. Thank you, Peter. All right, let's go to persistent and unexplained non-compliance. This is a particular form of non-compliance that really troubles us. Can you tell us a bit more about this and what we do when we find it?
Yeah, look, and that goes to our risk detection, Janet. So our approach to regulating care minutes is an example of the Commission being a risk-based and data-driven regulator. And that approach is at the core of our regulatory strategy. Having a risk-based approach allows the Commission to properly assess the risks of non-compliance and respond in a proportionate way to the potential for harm being caused. And that's why, as I've just answered put in that previous answer, is why we look at the totality of issues that a provider is facing. The department shares with the Commission the data that providers report quarterly on care minutes and also monthly on 24/7 responsibilities. This data makes it clear that where providers are self-reporting that they are not meeting their work, it makes it clear where providers are not meeting their workforce responsibilities. For residential services operated by these providers, we put in place a program of targeted monitoring using a mix of desk-based and site-based activities. And this is to make sure that these providers have suitable plans to deliver on their targets and fit-for-purpose strategies to manage quality and safety risks in the meantime. And going back to that question, that is something we would often do with a provider that is struggling to meet their care minute targets. We would go and assess the risks and make sure that appropriate controls are in place to manage those risks while they work towards their targets and also address their potential viability issues. We also want to assess where systemic workforce shortages are presenting a real challenge for compliance, which goes to, again, our desire to understand the causative agents of non-compliance. I also want to mention that in delivering against these provider responsibilities, we expect providers will communicate with their staff and people in their care about what they are doing to meet their workforce-related responsibilities. Through our daily contact with providers across the country, we know that the majority of providers are trying their best to meet their workforce-related responsibilities. They can show us evidence of the work they're doing to try and meet their care minute targets, and many are getting closer to the targets than they were before. But some aren't, and that's a problem. By applying trend analysis and risk profiling to the 3/4 of available care minutes data from 1 October 23 to 30 June 2024, the Commission is now able to identify those providers with significant unexplained and sustained shortfalls in care minute targets. And that's where we are currently focusing a lot of attention on the worst performers. And that is providers who have persistently large care minute gaps, who have made limited progress to close those gaps in locations where providers with services around them have much smaller gaps or no shortfalls at all.
So just before I go to the next question, which is obviously how do we use the provider supervision model to address those particular, that subset of providers. Just before I go there, though, I just want to underscore something you said and ask you to amplify it. So effort matters, demonstrable effort. If we see a provider who understands that they have a shortfall and they are doing everything they can to deliver on their care minutes targets, our disposition is different from when we encounter a provider who appears to be untroubled by the distance they are from the target and appears either not to be trying or not to be very effective in any effort they are making to close the gap. So I'm drilling this point because it's coming through in the line of questions as well. We are ultimately a risk-based regulator, and we rate providers who are doing their best to deliver the safe quality care that consumers need. So if you can demonstrate effort, it actually does count. Peter, do you want to just amplify that a bit, please?
Yeah, look, and it goes to us being a proportionate regulator in that we seek to understand the causes of non-compliance, and where there is evidence that there is a legitimate reason for non-compliance, then we will work with the provider to help them focus on those causes to ultimately meet compliance. So if they are demonstrating commitment and have really clear and fit-for-purpose strategies, we will monitor their progress against those strategies. Because ultimately we want the same outcome as a provider wants, to be able to have enough staff on the floor to be able to deliver good quality care. So we don't want to be an impediment to that, but what we won't tolerate is providers that have unexplained non-compliance and are demonstrating perhaps a lack of commitment towards meeting their targets, because it's not an either or. Our expectation is that where you can, you do meet your targets.
All right, let's go down that track then. So we've identified this subset of providers where we have unexplained, persistent and significant non-compliance, and including compared with others in the local geographical area who appear to be able to manage to reach their targets where this provider may not. So what action do we take in relation to that subset?
Yeah, and so what we're really focusing is on, a provider may have many services, but we're focusing on the cohort of services that they have that meet that criteria, because we want to make sure that they're doing everything possible to move to full compliance like their nearest neighbours. So I've recently written to those providers and I've set out the regulatory pathway. So providers in that category will definitely know who they are. And as I've mentioned, Commission staff have also been conducting on-site visits, and in these visits we are looking to see whether providers are doing everything necessary to manage risks to residents as a result of inadequate staffing while they work to meet their care minute targets. For those providers we are closely supervising that have persistently large care minute gaps and have made limited progress, the options they have are as follows. The first option is for them for those that show a genuine commitment to meeting their care minute targets and also have a fit for purpose workforce strategy. We've given those providers an opportunity to offer the Commission an enforceable undertaking. This means that they make a commitment to take an agreed set of actions within a reasonable timeframe. And the provider's written undertaking is then published on our website to ensure transparency and accountability. And we find this a very powerful way for providers to take responsibility for meeting their obligations, and we've used them to great success in other environment in relation to other obligations. And we then monitor the provider's performance against that undertaking. The benefit, I suppose, for providers who are willing to make the commitment and can and provide us with a suitable enforceable undertaking is that it doesn't have an immediate impact on their star rating. And we are looking, for those who are interested in enforceable undertakings, we are looking to publish a regulatory bulletin by early next week, providing some good detail on enforceable undertakings. So the second option in this situation where the Commission is unwilling to accept an enforceable undertaking, or indeed the provider doesn't wish to offer one because it is a voluntary process, is that we will be looking to issue the providers we've identified with a notice of intention to impose sanctions, which is commonly referred to as a non-compliance notice, or NCN. If the response to the NCN is inadequate, or if we then issue a notice to remedy, this will have an impact on the residential services star rating. In either scenario, the provider is entering into what I call an enforceable plan. The enforceable part here means that if the commitments that the provider gives to the Commission in those plans are not met within the agreed timeframes, we will impose a sanction. It's worth noting that if at any stage we uncover anything that suggests the provider is, for example, making business decisions that prioritise financial gain over fulfilling responsibilities such as care minutes, the provider will be investigated by our enforcement team to determine if their actions breach the code of conduct. Where we find that to be the case, we will consider whether that breach warrants a penalty being imposed. Now, remember where we started with the agreed proposition that a provider that complies with their care minute targets is much more likely to protect and improve residents' safety, health, wellbeing and quality of life. That's why we're taking this seriously. Under our provider supervision model, we expect that if we take regulatory action against a provider, that provider will be able to meet their agreed commitments under the enforceable undertaking or regulatory notice and thereby not suffer the consequence. And that is ultimately our hope, because that is the outcome we ultimately want to achieve, which is as many providers as possible having services that meet their targets.
And Peter, just one more question, and then I'll go to the panel session. To underscore the point you're making about voluntary effort, at every turn we are looking for providers to fulfil their obligations and to be proactive in that regard. So if a provider can demonstrate effort and impact from that effort, and they're willing to continue that and continue to close the gap, as long as it's happening in a timely way, then our position is one of monitoring. We will observe them doing it. We will ask questions from time to time if we become at all troubled. But as long as the gap is being closed in a timely manner, then the need for the Commission to intervene is actually not nearly as pronounced. Because the provider voluntarily is doing the necessary work that we would otherwise have to compel them to do. Is that the case?
That's right. And what we consider to be a reasonable timeframe will be within the context that the service operates, because we recognise that there are particular challenges that some services within particular locations will have, and so we will. When we assess a plan, we're assessing it against the challenges and causative agents that are causing that are leading to the non-compliance. But it will also, particularly if we are concerned there is risk, we will closely case manage that provider to make sure that we are seeing strong evidence and getting the assurance we need that risks of people are being managed in the meantime. So we won't just leave it to the provider in those situations. In some situations, and this is one of the great advantages of the supervision model, is we will maintain a case management relationship with that provider whilst they work towards achieving the targets, particularly, and we only need to resort to use of powers where there are unexplained gaps and lack of tangible process towards targets, which is why in a small number of cases we are focusing on particular providers at this time, where we see that an enforceable plan needs to be put in place to make sure that there is timely resolution of this issue.
Okay. Louise had a question in relation to enforceable undertakings, but I think you've probably addressed it in your comments. We are deploying that regulatory power for those we've identified through 3 separate quarters of data. So this notion of persistent and significant non-compliance is material. So across 3 quarters, so three-month slots, we are seeing providers who are consistently at a large distance from where they're expected to be, which says to us either, and we can ask this question of the provider, and we do, why are you there? Why aren't you making any progress demonstrably towards the target? Now, if there's no reasonable, persuasive answer to that question, then we will use a compelling power in inviting a voluntary enforceable undertaking or moving towards a sanction, because clearly that is not a sustainable position. That cannot be something that regulator is willing to contemplate or accept.
Yeah.
All right. Let me go to the panel session. Mark, I'll invite you back in at this point because I have some questions for you too, unsurprisingly. Now, there have been a couple of questions about the 24/7 RN target. And one of the questions has to do with the introduction of time delivered by enrolled nurses. And the question is, or one of the questions is, it's great that up to 10% of the RN target can be met by time delivered by ENs. Is this proportion likely to be changed in the future? Do you have any insights on that one?
Great. Thanks, Janet. And thank you to the person for the question. Look, I guess to go straight to the heart of it, no, at this point, there are no plans to change that 10% threshold. But what I should also do, I think, is clarify that any change would be a future decision of government. and we're also looking, I guess, at the data frequently on the basis that any change would be driven by evidence and the data that we collect.
Right. Okay. All right. There's another question here. We are in a metropolitan area and trying to recruit more staff, as indeed I'm sure a lot of their colleagues are too. The problem is we are also competing with healthcare providers like the hospitals. How do you expect us to meet our targets when we don't have the staff? Over to you.
Okay. Thanks, Janet, again. And also thank you to the person for the question. Look, I think there's probably three key things here. First of all, yes, completely agree. It's government expectation, as we've been discussing today, that facilities or homes meet their care minutes targets. Funding has been provided and they're legislated targets. So the expectation is that they're met. But I think the second thing is, and not to speak on the behalf of the Commission, Janet, but I think yourself and Peter have made it very clear today that workforce shortages and genuine, I guess, efforts to recruit will be taken into consideration as part of your compliance efforts around meeting those care minute targets. But I think the third thing to probably add to this, and it does go to, I think, the hospital component of the question that you asked. As I mentioned in my presentation, the government has fully funded the Fair Work Commission stage 2 and stage 3 increases across the sector, that's residential and also home care. That amounts, as I said in my presentation, to about $15.1 billion worth of additional funding. So that's there to attract and also retain nurses. And look, I guess by virtue of the question, I think it's probably important just to add at the very end, Janet, that there are a number of workforce support programs that the department has up on its website that's funded by government, of course. So I'd encourage people to jump online and go through those, and also to remind people also that there's an employee-sponsored visa programs that they can also look to access if they can't recruit locally.
Oh, there's some good tips right there. Thank you very much. Peter, some for you. I don't think we've fully clarified one point that Louise has come back on. She's wanting to know whether monitoring is the same as in entering an enforceable undertaking. Could you just separate those two out, because they are quite different, aren't they?
Yeah, look, and I'm sorry if I've caused any confusion around that. So monitoring is when we do one of two things usually. So that we may ask a provider for information about the things that they're doing to meet their targets, and we might that might be through an information request, and we'll consider the information in response to that, and then form a view about whether the provider is taking appropriate action. And also another form of monitoring is when we come on site, and we and that might be announced or unannounced, and we talk to staff, we talk to residents, and we seek to understand the level of risk that not meeting the target may be exposing those residents to, and also look at what mitigations the service has in place to control that risk. So monitoring is really just our oversight of what's happening, whereas an enforceable undertaking is where we get a formal commitment from a provider about that they are going to do certain things or bear the consequence of not doing them.
Okay, thank you. All right, this is a pre-submitted question, which is a good one. The place where I work is reporting that they are under their care minutes targets. I think that's right, because staff don't get enough time to look after all residents. Some of our residents stay in bed when, if they were helped, they could get up. What can you do to help fix this?
Yeah, look, and thank you, whoever put that question in, and it's an excellent one. It really shows, I think, how much, the workers on the shop floor really do care about this as well. So I think that's an important point for providers, and that's why it's one of the reasons that I said earlier that it's really important that providers, when they are often working quite hard, but they need to be able to communicate the things they're doing to their staff as well. Look, I think I think this question goes to something that we've dealt with recently. We had contact from a worker, very similar sort of to the person who's asked the question, who was concerned that residents weren't getting the care that they needed because there weren't enough staff on board. The complainant also told us that they could only fill shift vacancies from a casual pool, and if not able to do that, the instructions were to work short. For example, they were advised not to call agency staff. So that's exactly the kind of situation we're keen to see providers work hard to avoid. So we reviewed in response to that complaint, we reviewed the provider's performance against 24/7 RN and care minute requirements, and we saw that they were indeed under-delivering against both of their targets. We also had a look at the types of complaints and serious incident notifications we had received in relation to that particular service. So that's an example of how we look, not just at the specific issue, but around the issue to understand risk. That informed our assessment team, who then conducted an on-site monitoring visit, where we found that the provider was not meeting quality standards 3 personal care and clinical care and 7 human services. So that led us to put the provider under active supervision, and we've case managed that provider, and that provider has worked with us willingly and has demonstrated a commitment, and we've also complemented that with monitoring, which I've just talked about, and we have seen significant progress, and that provider has taken genuine steps to address the staffing shortfalls while also managing the risks to people in their care as they've worked to meet those targets. And so that's a good news story, but the origin of it was really a worker coming to us and bringing their concerns to our attention, because it was a bit of intelligence that we otherwise wouldn't have had.
Okay, thank you, Peter. Mark, one for you, perhaps a technical detail, but an important one. The questioner asks, do the care minutes apply to, or care minute targets apply to NATSIFAC funded services, the National Aboriginal and Torres Strait Islander Flexible Aged Care Services?
Great. Thanks, Janet. Look, the short answer is, and it's a standard target for NATSIFAC. So NATSIFAC services are required to provide the 215 minutes and the 44 minutes of RN time. Now, the reason for that is that NATSIFAC services aren't funded under ANAC, and as a result, their residents don't receive an ANAC classification, so they don't get that case mix adjusted service-specific target. But they are required to deliver the standard 215 and 44 minutes, as I mentioned. I think I should also add that they're also required to report on it, exactly like services under ANAC do, and very similar information they're required to report on a 6-monthly basis, that being, I guess, labour worked hours, costs, and also occupied bed days for the period.
Okay, thank you, Mark. Peter, back to you. Question from somebody who was a board member. I'm a relatively new board member for a small size provider. We have 4 services, each with about 60 to 120 beds. What kind of reporting should I ask for to stay informed? Now, this goes directly to that governance issue that we mentioned earlier. What should boards be looking for to understand not just compliance, but the strategies, the plans, and how they are being fulfilled by that service?
Yeah, look, thanks, Commissioner, and that is a great question, and governance is certainly something that we've been talking a lot about, and just because it's something that the Royal Commission really identified as being one of the key drivers for change in the sector. So I'm really pleased to hear that question from a board member, because you can play such an important role in driving assurance at the service level. So really, I think the starting point, as I've said and the Commissioner has said in other forums and including webinars, is that the starting point for board members is to be curious, and curious about the workforce strategies that are being put in place and how they are being monitored to ensure they are effective. So we want board members and chief executives to be knowledgeable about staffing levels and recruitment strategies, especially if the provider is not meeting their workforce-related targets. And so one of the key parts of monitoring that a board should do is just knowing where they are meeting their targets or not meeting their targets, and also how they are trending over time. I think the things that we're interested in, you should be interested in as a board member, and the sorts of information that we seek from providers to understand why a service is operating, what the service is doing or what the provider is doing to meet their care minutes. Is we're interested in whether paying conditions on offer are competitive compared to counterparts in the local region, where and how often jobs are advertised, and the outcomes of recruitment, especially if jobs remain unfilled, and the reasons for that, because there will be genuine reasons why you might get lots of applicants but may not choose those applicants. We're interested in what engagement and partnerships the provider has with local university, TAFEs or registered training organisations. So I think as a board member, understanding the strategies that the provider has around building opportunity. What do the rosters look like? How many shifts don't have an RN, and are current workers being asked to repeatedly work extra shifts or overtime? Because this is a situation where you maybe a service may be meeting its target, but it may be meeting its target through large amounts of overtime, which we know will ultimately impact the welfare of both workers and people receiving care. The other thing that we're interested in is what are the care minute targets for each service. So if you're a provider with a number of services, you might look at that collectively, but then also knowing what that means at each service, and also what that provides a board an opportunity to do is compare results and also prompt the right sort of questions about why one service which has similar issues is doing better than another service, because that way you can start to identify your outlier. And our sense that where board members are actively asking these types of questions, they are overall better placed to oversee how their services are meeting these workforce responsibilities, but also to be able to explain to us when we come knocking what they're doing about it, because that's what we're interested in. Is we accept that there will be times where you just can't meet your care minutes, but we want to know what you're doing about it and how hard you're trying. And so a board that's asking those sorts of questions will be well positioned to respond to us.
Okay. Mark, final question for you. A fair few of the questioners have asked what assistance is available in relation to workforce supply. Now, I'm not expecting you to recite the full list, but I'm fairly confident that a lot of that information is available from your website. Is that the case?
Most definitely, Janet. So there's I think a budget this year. Government provided ongoing funding to a number of existing workforce initiatives. So people can definitely jump online and go on the website and get a list of those. So look, yeah, I'd definitely encourage people to do that, Janet. Okay.
Peter, I said I lied. The final question is actually for you. Can you share, Channelwood wants to know, can you share successful case studies or examples of providers excelling in workforce responsibilities? I think that sounds like a fine idea. I think that we would be willing to take that on to look at what we can offer back to the sector to give you some examples of who's nailing it, who's doing a really good job. Would you agree?
I agree. And look, some of the providers we've had under case management, they've really turned it around. They've understood the importance of the obligation, and they've developed really, innovative strategies, and they've started to succeed. And it improves the culture of their organisation, and it has lots of flow-on benefits. So, it's early days, but there are those that have really managed to turn things around, and I think we can certainly share case studies around that.
And it also goes to some of the other questioners who were expressing concern about the reputation of aged care and how it sometimes comes off second best compared with the offering from healthcare. Well, let's celebrate success where we find it, all of us, in order that people can get a fairer reflection of just how hard the sector's trying. We have a way to go. There is non-compliance. We've talked about that across the course of the hour we've spent with you. The Commission is very concerned about it. We will let you know, and we will be expecting you to lift. But we are seeing success, and we will be able to talk about that increasingly to show everyone what can be done and what can be achieved by an aged care provider who's trying hard and has that capability. So I'll close off there. My apologies to those whose questions we did not get to, but I will commend to you our own website and the department's website, where you will find lots more information, particularly in response to some of the questions you've asked, which are more design details around care minutes and how they calculate it. Thank you all for staying with us across the course of the hour. As I mentioned earlier, we have been recording this webinar and it will be published on our website, and you will receive a link to it if you registered. I definitely encourage you to check out the additional resources which are available both on our website and the department's. And a reminder, please, to stay online for the feedback survey. Very keen to get your comments, your opinions, your perspectives on the ground we've covered and what more you'd like to hear from us. Thank you, everyone, for participating. Take care. Bye-bye.